My name is Dr. Laura Newhauser. My role in the residency program is as an associate program director and the director of osteopathic education. Osteopathic recognition is the step we took to make sure that we were able to provide our residents from DO schools a continuation of their osteopathic curriculum, both the philosophy of osteopathic medicine and the practical skills.
I was the first osteopathic resident in this residency, and a big thing for me was to be able to get osteopathic recognition and to have an osteopathic clinic formed. I told Dr. Manival, our program director, hey, I want to do this. And she was like, okay, cool, we'll do it then. Osteopathic recognition means that our program has been recognized by the Graduate Medical Education Accrediting Board as specializing in teaching osteopathic medicine. I've been able to get the support of all of the faculty. We have special attendings who are DOs, we have classes for DOs, we have workshops for DOs, we have grand rounds just dedicated to osteopathic medicine that everybody can attend. So there's a lot of education for those who still want to pursue that style of medicine.
Osteopathic recognition to me is kind of a way to continue to build on my education. It lets me know that they're going to continue to kind of cultivate and develop those skills that I began learning in medical school and allow me to grow on my osteopathic education, whether that be through osteopathic manipulative therapy or just kind of the principles that help to guide osteopathic medical education.
The core part of our curriculum for osteopathic residents is participation in a dedicated OMT clinic, spending a half a day, usually every other week, in the family practice clinic with Dr. Erdman, working that one-on-one time, and they see just patients that they're going to do manipulation on. We're lucky to have Dr. Kenneth Erdman at the Family Practice Center, who does do a lot of manipulative medicine. The residents work with him one-on-one. And they participate in that as a first-year resident. Then as they move into a second and third-year resident, once we and Dr. Erdman feel that they're competent and more able to practice independently, they actually integrate that into their day-to-day continuity clinic. So they may go from seeing a sore throat and a hypertension to a back pain to a hospital follow-up.
We're very inclusive. We have people of all ages, all genders, all ethnic backgrounds, and of course, both MDs and DOs.
MDs are also welcome to participate, and we do have a kind of a pathway for them to integrate into that track.
When we do workshops or we do things out in the community or in the clinic, we have both our MD colleagues and the DO colleagues both working together to learn the techniques. And it's a fun time for us to kind of teach our fellow colleagues some of the fun things we learned in medical school that they didn't get to learn. And so it's just a nice way of kind of sharing knowledge between each other.
Having gone to an osteopathic medical school, it was important to me to kind of continue to build on what I had already learned. And knowing that this program had osteopathic recognition and that I had the opportunity to be one of the designated osteopathic residents, I knew that I would have the time and the mentorship to continue to cultivate like the osteopathic manipulative therapy skills and just kind of the principles that osteopathic medicine's built on.
We hope to prepare osteopathic residents to really practice medicine in any capacity, outpatient, inpatient, but they will hopefully have the confidence in those extra skills. It's kind of an extra tool in your toolbox. There are no more specific, strictly DO residencies, and so that has really been a way for us to attract residents from osteopathic schools, because it sets us apart as letting them know that we have the curriculum and we have the support.